Good morning. I'm going to go ahead and get us started. So I'm going to call this meeting to order of the Assembly Housing and Homelessness Committee. Today is Wednesday, November 15th, and we're noticed from 11 a.m. to 12:30 p.m. here at City Hall, room 155. Let's go ahead and start with Assembly member introductions.
Karen Bronga.
Daniel Voland.
Felix Rivera. And then on the phone, we have Mr. Martinez.
Yes, thank you.
Great. And then Mr. Cross.
President accounted for. Thank you, Felix.
Great. Thank you. Both Member Browley and Member Constant are excused as they are traveling out of state for a conference. Okay, so let's go ahead and start with initial audience participation. We have one individual signed up, Mr. Oliva. You will have 3 minutes. We'll put your timer on for you. So just wait until the timer's up to start. Otherwise, welcome.
Thank you. Ron Oliva, adjacent property owner of Brother Francis Shelter for over 40 years, a professional in homeless issues, especially all the effect, the overflow affects the adjacent properties. Yesterday, I was cut short, so today I'll even have to talk faster. But in summary, the bottom line is to compensate me the difference in the purchase of my properties, and then to initiate getting those funds or have you buy, lease, or use my property as a homeless service area. I've made several proposals. But what the conclusion is coming from the articles I referenced, the last two Sunday papers, especially Dave Rittenberg, and I couldn't understand and make the connection. If the capacity of the Brother Francis Shelter is 240 and you're at 120, why would you take the overflow at the old Native Hospital and put 274 downtown? It's been a burden on downtown. There's no services at a hotel equaling that of the shelter, or right across the street is the navigation center for services. So that doesn't make economic sense or help the homeless whatsoever. Just costs more money with less return. Now, following that up was the good neighbor policy referenced by 3 presidents of the community council. That does not work. It hasn't worked. Dave Rittenberg came to my house like you, Felix. We discussed it. It has no bite. It has no effect. And regardless of what the community council president said, they're making recommendations to put up a economic impact area and allow for compensation. My compensation comes in a third form, that because you've tied me up economically with safety and security issues, I'm in foreclosure with my taxes. Previously, Berkowitz gave an extension because of COVID. I got penalized there. I got penalized this year because I could not perform the services that were necessary to generate the revenue to pay the taxes. So I want forgiveness on the penalty based on that. It's already been noted by senior appraisers, just the stigma of being next to the shelter lowered my tax assessment. So I want this economic compensation, and I will make claims to the city without litigation. Do you have any questions?
Thank you, Mr. Oliva. I don't see any questions. Thank you. All right. As always, I'm going to do my best to leave time at the end of our meeting for final audience participation for folks who want to do that. Just before we get started with our unfinished business, I just want to start this meeting with a little bit of a positive mission moment. So last week, I hope to have it here, but it's not here at City Hall right now. Last week, the Assembly received a pretty wonderful thank you card from residents staying at the Alex Hotel. Hopefully folks got a chance to look at that at the Assembly meeting. The work we are doing, both legislative and executive, is having a positive impact on our residents most in need. This, of course, is balanced with the very sobering and heartbreaking news that we got last week about the multiple outdoor deaths. I hope that we can move forward together to meet the needs in our community, both in the short and the long term. And speaking of the long term, because mainly we're going to be talking a lot about the short term here, but speaking of the long term, the broader work, we know that housing is the solution to homelessness. And that's why this assembly has made strategic investments over the last several years in housing, and we will hopefully continue to do that. Aside from housing, we know that there's a general need for more shelter in our community. And that's why the Assembly and this committee in particular is going through a community process to drive to a successful outcome, which has evaded us for years, to the need for more permanent year-round low barrier shelter. We are working to achieve both of these needs in our community, shelter and housing, as well as the supports needed to help people stabilize and maintain their housing. So everything that we do here in the short term, when we talk about emergency cold weather shelter, should work towards our long-term goals. And I think you'll hear that as we start diving into the implementation and the transition out of emergency cold weather shelter. So let's go ahead and start with unfinished business 2023-2024 emergency cold weather shelter plan implementation update. I have a few topic items. Some of them are new, so I'm just going to go through the topic items and then we're just going to go one by one through these. So under this particular bullet, we're going to have warming areas and additional shelter. So we'll start talking about those. Third-party oversight, talking about food, talking about abatement, the 2023-2024 budget need, data and metrics and outcomes. So those are going to be the topics that we discuss with regard to implementation update. Let's start with warming areas and additional shelter. So what I'll do is I will verbalize my questions that I stated to the gave to the administration. Members should have received responses to those questions that I sent in advance to the administration earlier today. And we'll go ahead and have some amount of discussion as much as we can. Do we have a representative from the operator here who is able to speak on behalf of Henning? Yeah, if you want to come on up too, because at some point we'll have questions for Henning as well. Ms. Johnson unfortunately could not be here today. She is traveling. So we will do our best to work through these questions and discussion. And if there are questions that we don't have an answer to from the administration, I believe that Mr. Byrd has committed to working to get those responses to the committee. So I appreciate that. And thank you all for being here. So let's go ahead and start. So for warming areas and additional shelter, what are the plans for warming? Will warming be able to be stood up before cold temperatures set in on Friday and throughout the weekend? So we're going to have a spat of negative temperatures this weekend, which is of particular concern to me. If not, will the administration consider declaring a civil emergency to expedite meeting this need? And then what are the additional plans for shelter? We, of course, took up the 50 additional shelter beds yesterday. Want to know if there's any additional plans outside of those 50. So let's start with those questions and then we can have discussion from there. So I don't know, I know we got that email. I don't know, Mr. Byrd, if you just want to, for the record, just so that the public and it's on the record, if we want to state those responses.
Through the chair to the committee, thank you for the question. So our understanding through the administration is that we are setting up warming facilities. The one that we've been in touch with is Graceful Touch. It would be a 50-person warming facility, I believe, in the Fairview area. They are in contact with us. They need a minimum week to turn it on. There's been a suggested appropriation of $226,000 for a 5-month contract. That is, I believe, what's in discussions right now. As far as the civil emergency, that's not something I have an answer for, but I can certainly go back to the mayor if that's something that the committee is asking about.
Thanks. And can you talk about additional shelter?
Through the chair, I don't have notes on that, or if I do, I'm not seeing them. So I will make a note and I'll get back to you unless Mr. Brand, if you have any idea.
I don't have all the details, but the original 150 person capacity at the SWS facility was raised to 200. So there was the increase of 50, and it's my belief that at the regular assembly meeting next Tuesday, that it may be raised 50 more. I think that's something that's been discussed. So.
Yeah, thanks. So, as I understood it from the special meeting that we had yesterday, yeah, it was just yesterday, we did increase from 150 to 200. During that meeting, Ms. Johnson did state that she believes 200 is the maximum occupancy that the former SWS administration building can hold. Slash, there's also some staffing issues if we go above 200 that would make it difficult for the operator, as Ms. Johnson stated.
Okay. My answers are speculative at best. So.
Okay, thank you. All right. Yeah, it would be good to know if outside of the 2 non-congregate facilities and the now increased congregate facility, if the administration is looking at anything else with regard to shelter. It would also be good to know if the administration is looking at anything else with regard to warming in Midtown. That's a request that I have made to see if we can get some warming stood up in Midtown, because I believe that there is a need both in downtown and Midtown to have warming. Okay, so I have myself in the queue for some questions, and then if other folks have questions on this topic, feel free to put yourself in the queue in person. Just wave at me on the phone. Please text me. So some questions I have is, will the administration be bringing forward the $226,000 appropriation for warming at some point? And then if so, what funds will the administration be using? We'll start with that one.
Through the chair, to the committee, yeah, my previous answer, my understanding is that the 226,000 is an appropriation that will be sought. The funding source, I will have to find out and get back to the committee on.
Okay, thank you. And then does that 226,000 figure include food? Because the assembly, we got some sort of basic pro forma of the cost, and then, well, no, of the operations, and then the staffing levels. And it looks like this warming area is going to look at serving food 3 times a day, which is great. But does the 226,000 include food, or are we looking at like partnering with Beans Cafe to help provide the food to lower costs?
Through the chair, I know that food was part of the discussion when we had an internal meeting yesterday, so I believe that is part of it. But as far as a line item or how much of the 226,000, I don't have that answer, and I'll provide that to the committee as soon as I can.
Okay, thank you. And I guess just a final comment, and then if other folks want to get in the queue. So for my part, it is a little bit alarming to me that we're not going to have a non-shelter location for our unhoused neighbors to go to during the cold this weekend. I'm very glad that those 50 additional beds will be stood up at the congregate facility, and I suspect that I think some of the estimates I'm hearing is that it's going to be like a week or so before those beds are full. So it might take a little while to get those beds full, but there are individuals that we know of in the community who have expressly stated that they are not interested in congregate shelter, so they will not be going to that facility. And so we don't have an option for them in any extreme cold events that we have. So I would really encourage the administration to do whatever it takes to stand up warming as soon as possible for that population. And if that requires you to declare a short-term civil emergency that's very tailored to meeting this need, speaking for myself, one of 12, and as chair of this committee, I would ask that happen, because this needs to be stood up sooner rather than later. Any other questions or discussions? Yeah, Mr. Voland.
Thank you. Yeah, I do want to talk about the warming area location and how that was chosen. One of my concerns about that, just that specific location, and maybe it's just at the, Graceful Touch, that's where they're based, or that's their headquarters. I don't know, but certainly not the most safe corridor for pedestrians. I think that's a concern, and I'm wondering if the operator has a plan to address that. And then I'm also curious about, for those folks who have expressed that they do not want to go into congregate shelter, where where are most of those folks located now? Because I think I saw an update that there's going to be some limited abatement happening at Willowa, but we don't know. We don't have any plans for abatement beyond that. Abatement has been done at Third and Ingra, and I think we are anticipating that there will not be abatement then. Well, there will, I guess, be an effort to have people move from the Mountain View snow dump location to Davis Park. So I'm just trying to think of like where are the easiest locations for people to get to, and like where's the need if people are going to be walking from their, if they're car camping or they're in their trailer. And I think potentially Mountain View would be a good location for a warming area for that reason. If there's a bunch of people who are still going to be staying around Davis Park, I guess those are my thoughts. I'm just putting that out there. But yeah, do we have any insight about why that specific location in Fairview was chosen?
Through the chair to Member Voland, I don't know specifically, other than it was something that was brought up internally yesterday before Ms. Johnson left. So I'll try and find out how that process worked out. As far as the Mountain View warming area, I think those are all good reasons that are related to Davis Park and the snow dump. In our internal meeting, we definitely discussed a Midtown warming center as well as the Fairview one. So I'll chase down those details if I don't have them here, and it doesn't look like I do, but we'll get you some responses.
Thanks.
So Ms. Bronga, and then I'm going to see, can the coalition representative come up to the table, please? And then I may have some questions for you generally system-wide about where our unsheltered populations are located so that we can have a good sense of where we should be setting up warming. So I might come to you after. And then I've been asked, is there anyone from Graceful Touch who is in the audience? If there's someone from Graceful Touch listening on the phone, if you could please email me so maybe we can get you, there might be some questions for you. So it's felix.rivera@anchorageak.gov. Ms. Bronga.
I agree with Member Voland that around the Mountain View area for a warming shelter seems pretty important. Willowa, if you abate there and you go directly east into Russian Jacks, there are some hardcore campers still in there, and they're going to need warming, I'm certain. And so somewhere on that Pine Street line, I know it's really difficult for constituents to hear you want a warming shelter in the area, but as far as keeping people safe at Davis Park and Russian Jack and Willowa areas, that's pretty important. I also wanted to express the number of people experiencing homelessness that have emailed me. I feel like the hotels gave us a difficult scenario here. Some of the people are just, hard set. They're not going to go to congregate shelter because they still are hanging on a dream of a hotel room. And, if I feel like we need to give them a shelter space, but it's very frustrating that they're still thinking, I want a bed. Why don't I get a bed? And I think it's given a hard situation. I don't know if Hennings is feeling that a little bit, and if you could speak to that.
Check. All right, yeah. Rob's the community liaison for Henning. And yeah, we are concerned about that too. We have been working off the wait list primarily, but I think that we're headed to a situation where, there are a lot of walk-ups coming up to the SWS. And we have been able to triage people based on needs at the SWS into congregate, non-congregate beds. But yeah, a lot of people that are on the wait list are saying they don't want to go to congregate sheltering. And just to let you know, I checked with our program manager over there. We are already out of that 50 that was extended yesterday. We're up. We have 25 beds left. So, yes.
Thank you, Mr. Cross, and then I have myself in the queue.
Thank you. This question is for Henning, Representative. I'm curious to what percentage of beds go unslept in at the SWS on an average evening due to individuals who do not return, who check in, reserve a bed, and then don't return by, I think it's 10 p.m. when you guys close the doors. What percentage of beds do you think are probably left vacant by people who reserve them and then don't show up in time to occupy them?
That's a great question. I know one night, I haven't checked every single night how many beds are being unoccupied, but just sporadically when I was there a couple nights ago, there was 15 beds of people that had not checked in that night. So, but I can check and get a thorough answer for you and send that out to the committee.
All right, well, that's interesting. If you got 15 out of 150, we got 10%. So I guess my thought on this is, and I don't want to micromanage because I trust your judgment, but perhaps, a curfew of 9, and if you're not there by 9, then it's whoever's outside waiting in between the hours of 9 and 10. I'm just trying to make sure that we utilize every bed that we have available for those individuals that perhaps were late showing up to reserve one, but then are waiting in hopes that they get a bed. So just something to consider, and I appreciate that. Thank you.
Yeah, and yeah, that's definitely something that we are considering, and as well as the wait list process. All those are different things that we think we need to make some adjustments to. We're open to, we have open dialogue with whoever has some input on that, and something that we definitely want to triage. So thanks.
Thanks. So my question is for the coalition representative, Ms. Parks. So can you talk a little bit about warming areas and the understanding that the coalition has of current unsheltered population locations, so that, for example, do we really need a warming center in downtown? My gut tells me that, yes, I think a warming center downtown would be helpful, but I want to make sure that these areas are where the populations are.
Thank you for the question. Jessica Parks, I'm the Chief Operating Officer at the Anchorage Coalition and Homelessness. What the ACH coordinated outreach teams have been identifying are a lot of the places that people have mentioned. So the Davis Park and those surrounding areas. So some of the adjacent wooded areas to that park area, not necessarily in the park. The downtown areas, I think we've seen an uptick there. Of course, the archive site down near Cuddy Park, off of Raspberry Road to the west. There's quite a few wooded areas through there where we're seeing some encampments. The Abbott Curve area going around to the Diamond area. There's a small encampment back behind the old Sam's building down there. Russian Jack Park, over near the Alaska Native Heritage Center. So those wooded areas that are down there near the highway, and then overflowing a little bit over to the other side of the highway where there's the wooded spaces along the area near Centennial Park, not necessarily in Centennial Park. So those would be places where we've seen groupings of people.
Got it. Thank you. All right. Any other discussion before we move on to the next topic? Yeah, go ahead, Ms. Branga.
I just want to follow up on the question about Cuddy Park and people saying they want to get out and go. I don't really know where they want to go, but I've heard now that the gate was opened and shovels were handed. And I don't know realistically if anyone could shovel their RV out of there at this point, or their trailer. And is there if they hired a private service to come and plow, could they get themselves plowed out of there? Would that be allowed?
It's a good question, and we're having discussions currently about what we're going to do with the Old National Archive site. We did a count yesterday. There's 72 vehicles on the total park property, our park and archive site property. 55 of them are behind the gate. And basically with the two big snows now, those vehicles can't get out. As of today, we've discontinued the security because of the snow and just the dark also, but just the whole layout of the place with the snow. They can no longer really observe and report. And there's no sense in opening and closing the gate and hiring a company to do that, because you can't drive in and you can't drive out. So we are continuing to have discussions about what the approach would be to help folks get out, or if it's a good idea to tow them out anyway. I think it's a really challenging situation we're facing over the next 5 months, behind the gates. So did that answer your question thoroughly?
Yeah, it did. So if someone, Mr. Sutherland is the one who's been emailing, he probably has emailed you, and it sounded like he could hire a private plow, but he was not allowed to for whatever reason. And he wanted to plow out. He said that he's disabled and the shovel is doing nothing for him.
In my opinion, and we in Parks and Rec are in the snow removal business as well, so I'm familiar. I think you're going to have to bring in a plow isn't going to do it. A plow on a pickup isn't going to have any success. You're going to have to bring in a high horsepower machine with a auger and a snow blower. And then I think once we start to get into that sort of approach, we would just rather do it with municipal resources if we're going to do it, because it really shoots the snow out of the discharge chute hard and fast. And we would just want to be in control of that operation, I think, as opposed to just allowing somebody to. Yeah.
I appreciate that.
Sure.
All right. So our next topic under implementation of emergency cold weather shelter is third-party oversight. So has third-party oversight been awarded? Has third-party oversight begun? If not, why not?
Through the chair to Member Rivera, this is in the written response I think that Ms. Johnson already gave, but my understanding is that yes, third-party oversight has been awarded to RRS, which I think was the same party that had it last year, and that the oversight has not begun, but it's slated to very soon.
Thanks. As I understand, there was an issue in purchasing that's holding the contract up. Can you speak more to what that issue is? It's been almost a month, and it would have been great to have third-party oversight to help out during the implementation of shelter. So can you speak to that a little?
Through the chair, no, but I'll get you an answer.
Thank you. Any other discussion on this topic? Hopefully, once third-party oversight comes on board, I think we're going to start with, as I understand it, possibly weekly reports, maybe biweekly reports from them. And typically, third-party oversight will have regular meetings with the operator, with the administration, and with some members of the assembly as well. Yes, Ms. Braga?
I just don't really know and I apologize for not being up to speed, but the warming shelter, they won't be able to spend the night, or will they? It's just coming, if you are freezing in the night, are you able to go and warm up or not?
Yeah, thanks. So I mentioned this a little bit yesterday, and I'll just reiterate. So you have not been hearing me use the term warming shelter, because these are not shelters. These are centers, areas, whatever term you want to use, but these are not shelters. So this is not an area for folks to be able to sleep at night, but it is a space where folks should be able to come in and warm up and get access to food, get access to case management services, that kind of thing. 24/7 is going to really depend on the operator. Typically, there are hours, and so I don't know if we know Graceful Touch or whatever their name is, if they have specific hours. Do we know that?
Sorry, through the chair, I don't know.
Thanks. Okay, then moving on. Next item is food. So in a media report earlier today, there was a surprising quote from a Henning employee. I'm just going to read that quote. It was in an ADN article. Quote, so the food source for these guys is kind of small. This is speaking to the congregate facility at SWS. They have to travel a long way to get some food, end quote. So I've long said that shelter should be located near a source of food and should also have plenty of food on site. Choices and options are important, in my opinion. Can the operator please speak to this issue? Are there 3 meals being offered a day to folks at the congregate site, or like are folks wanting more food than are being offered? Why are folks wanting that access to food outside of shelter?
Through the chair, yeah. So the issues that we've had, as far as food goes, I mean, food is being delivered three times a day, but there isn't any other stores around. So, like if new intakes come in and they miss dinner or something, there aren't any other options. Like any food that is available to them is directly at the shelter. When we did it at Sullivan, there's a lot of different options for people to go and find food. But I think that she was speaking to the direct question from the reporter, and the question was, are there any issues with food? If there are some issues, that's the issue that we have. But ESS has done a great job of providing meals there on site, and we've been able to supplement a little bit with a dry pantry. But again, it's not perfect.
Okay, thank you. Yeah, hopefully between a pantry and maybe having some like additional meals on site, I think that might help. But hopefully, I trust that you all will be able to work through that. Any other questions on food before we move on? Okay, then abatement is next. So are there any abatements planned currently? With the additional 50 beds coming online at the congregate facility, will any new abatements occur? And if there's any additional beds brought online outside of those new 50 beds, will any additional abatements occur?
So we have a 10-day zone abatement that was posted at Willowa Park 12 days ago, and the plan is to abate tomorrow when the CAP team is available. And I think that there's about 8 people that are living in the camp, and AHD Outreach was out yesterday and offered shelter to each of the people that were there, and each of them declined from what I heard. Beyond that, there's no other abatements that have been posted. And unless more shelter comes online, I don't imagine that we would estimate that shelter space could remain open for 10 days while a zone abatement notice transpires. And then just in the example we've spoken of today, the 50 beds are down to 25 very quickly. So I don't think we have any plans to post any future abatements.
Got it. Thank you. Any discussion or questions on abatement? Yes, go ahead, Ms. Branca.
So the people that are in the Russian Jack right off Pine Street to the direct east of Willowa Park are in there to stay away from the Willowa Park shenanigans. And I can envision if they're rejecting shelter, they're going to move right into Russian Jacks where these other campers are trying to avoid them. Just that's a FYI.
We'll keep that in mind as we work cooperatively with APD. I think that that's often the case. The cause for this abatement posting or notice was there's a large mobile home park right next to Willowa. They were having a lot of neighborhood impacts that APD had traced back to the camps, and yeah, that's what's driven it. And I suppose that could be the case that you've outlined. So
I really do appreciate that mobile home parks struggles with Willowa campers, and thank you for the abatement, actually.
Sure. And I would just reiterate to campers in Russian Jack, if they have those sorts of concerns, that we're in a short window right now where shelter's available. The last few shelter beds are available. The weather's tough. Generally, shelters fill up fast when the weather gets tough. And I think this is the time to really seize the opportunity. So.
Thank you. Mr. Voland?
Thank you. Yeah, I'm just thinking about this, and to me, with where we are currently, with our existing shelter capacity, I I think the abatement of Willowa, I feel differently. I think it seems a little bit nonsensical. I think partially for the reason that member Bronga brought up is that, folks kind of choose where they want to be and they seek out their safety and they have their groups. I think also if the issue is criminality, my question is then why isn't APD addressing that rather than just moving? If people are truly causing public safety issues, why just move them somewhere else in Anchorage to do the very same thing? If it's just a group of 8 people, it seems to me that APD should do their job and address that activity. I'm very concerned about the implications of Martin v. Boise and justification that is being used for abatement. And I think we need to, as a community, really think about our values. And for me, that means separating. It means not conflating criminality with housing insecurity and homelessness. And although there may be people that are housing insecure or homeless that are engaged in criminal activity, that's its own problem. That's separate to me from camping. And I think until we have that capacity that we truly need, where we can provide folks an option, and I guess that the option would be, because to pick specific camps and say we're going to abate this one but not this one, I don't know about that. I think what we need in the long term is we need enough housing and shelter capacity to say we have a place for everybody, and then we can enforce our camping laws. So that's just I guess my thoughts on that.
Thanks. If there's no one else, then just to make my view on the matter very clear, in my opinion, abatement during the winter is one of the most harmful things that we could do for people experiencing homelessness. Moving on, 2023-2024 budget needed. So does the Anchorage Health Department have a budget number for January through April 2024 emergency cold weather shelter? What's the current burn rate? Are we on track? Are we overspending, underspending?
Through the chair to the committee, again, these are written responses you already have, but for the record, the current budget is $6.2 million for the Alex, Aviator, and Solid Waste administrative building. It doesn't account for increases at Covenant House or Brother Francis. The current metric they're using is 574 beds times 90 person to person times 120 days. So the burn rate, as I am understanding this, is we're burning at the highest rate right now, according to that budget.
Thanks. So certainly it is my expectation that if the administration needs additional appropriations for emergency cold weather shelter, that you have those discussions with myself and Assembly leadership. There is a budget amendment to add some additional funds for emergency cold weather shelter, but if additional funds beyond that are needed, please have those conversations with us. Any other discussions on budget? Okay. Then we have 2 items left under implementation of emergency cold weather shelter: data and metrics and outcomes. We'll start with outcomes. And then what I want to do is transition us, just looking at time, to our next presentation at around noon, because I think this next presentation will be very enlightening and helpful for folks. Okay, so on outcomes, there's quite a list here, but I'll go through these quickly. How are we doing with meeting policy measures set by the Assembly? Namely, have navigation services been turned on at the congregate facility? What navigation services specifically are there currently? What navigation services specifically is the operator trying to bring online? What providers specifically will be providing those navigation services? What is being done to help people move on in their housing services journey at ECWS? How many current cold weather shelter clients have access to vouchers? What barriers are preventing cold weather shelter clients from utilizing their vouchers? How many current cold weather shelter clients have been able to access housing? how many how many cold weather shelter clients have some kind of income, and have clients at cold weather shelter been entered into HMIS and had a CE, coordinated entry assessment, completed? So long list there. Go ahead.
Thank you, Mr. Chair. So again, these are part of the written responses, so I'll just make sure to state them for the record. So the first question, have navigation services been turned on at the congregate facility? Yes. We are currently in a stabilization period where people, both the staff and the clients, are getting acclimated. They are doing, that is the staff there are doing assessments for each person who comes in, and the staff are also engaging with the clients and forming relationships with them. The second question that you had, Mr. Chair, I understand is, or would you rather just go one piece at a time in case other members have follow-ups?
You do all of them.
Yep.
I think they're all general.
Okay, will do. So the second question, what navigation services specifically are there currently? And the answer to that is there are housing specialists at the sites providing navigation services. Navigation services are housing focused. There's also a mobile clinic for health services, and the scheduled services include training outreach, SNAP outreach, and Alaska behavioral health. Third question, what navigation services specifically is the operator trying to bring online? I'm sure they can speak to it better than me, but as I see here, additional medical services, job fairs, training, and also housing providers. Fourth question, what providers specifically are providing navigation services? This is the list. NeighborWorks Alaska, Catholic Social Services, Partners for Reentry, Anchorage Neighborhood Health, Downtown Hope Center, in addition to the AHD housing team. Fifth question, what is being done to help people to move on in their housing services journey at the emergency cold weather sheltering? The answer there, support staff is engaging with clients. There's conversations that are housing focused, and the housing specialists continue to navigate these folks to housing and supportive services. Sixth question, how many emergency cold weather shelter clients have access to vouchers? 14 as of yesterday. Seventh question, sounds like there might be a different answer there, so maybe we'll come back to it. Number 7, what barriers are preventing emergency cold weather shelter clients from utilizing their vouchers? So there is one that's a registered sex offender. There's several that have no income and landlords aren't renting to them. There's several that are unaddressed mental health challenges. Looks like there's some other prior records that are causing their applications to be denied. So I don't want to go any further into those details. And I think that was the list of questions you had, Mr. Chair. Correct me if I'm wrong.
There were a few others. I'll just read them, save you from doing that. How many current emergency cold weather shelter clients have been able to access housing? 2 from the Alex have moved out and accessed housing. How many emergency cold weather shelter clients have some kind of income? 116. And have clients at emergency cold weather shelter been entered into HMIS and had a coordinated entry assessment completed? And the answer is yes. So I appreciate all of those. So I had one additional question, and then we can have any discussion folks have on that. So what are we doing to overcome the barriers that were listed? So just to reiterate, those were one is there's someone who's a sex offender, folks who don't have income, folks who have unaddressed mental health challenges, and folks who have prior evictions or criminal records. It looks to me like several of these issues can be overcome, whether that's helping people get access to income through SSI, et cetera, workforce programs, which I'm glad to hear that there are those job fairs happening for folks who maybe are able to and willing to work so that they can gain some income. The landlord partnership at United Way might be able to help with some of these issues that I'm hearing here. So how are we workshopping through these barriers and resolving them?
Mr. Chair, I don't have an answer for you right now. I'm not into those granular detail, but I'm certainly going to bring it back and to the committee and get you an answer.
Thanks. And I'm wondering if maybe the operator can.
Sure, I can speak a little to that. One thing we have done is created relationships with property owners, landlords that we know personally that are willing to master lease their units and properties. So that kind of gives us a little buy-in as far as being able to provide a hand hand up for individuals who are coming out of homelessness and even like reentry. So we we do have a property in Mountain View, a fourplex, all filled with people from reentry or that people experiencing homelessness. We have a sixplex in Spenard that we master lease with just private owners. That's filled with individuals who previously were experiencing homelessness or coming out from incarceration. We have a 3-bedroom house in Fairview as well, and we just closed on a 4-bedroom property on 15th Avenue. So really, we're just grinding and utilizing grassroots efforts between landlords and private entities and real estate agents as well. So really, just trying to find the right people, build the right relationships.
Thanks. Do we have a sense of how, so I guess to the coalition, because I think you've helped out with a little bit of this work. So as I understand it, rooms from the Barrett Inn will be coming online shortly. If not, some of them have already come online. Do we have a sense of the cross between folks? And also, as I understand it, there was a lot of work to do, like pre-leases to get folks set up. Do we have a sense of the cross between people who are on that pre-lease list at the Barrett and folks who are at Emergency Cold Weather Shelter right now?
I don't have the exact number off the top of my head, but I know that it is somewhere around 15 to 20-ish. The units that were in, I call it the annex building, so the separate building across the street or across the parking lot from the main building, are occupied and online. The main building is coming online in phases due to work still happening, but some of those units will be filled as early as the end of this week into next week, going into early December before they're all available to be occupied.
Great. Yeah, I think any movement out of Emergency Cold Weather Shelter is helpful. So much appreciate that work. Okay, any other discussion on outcomes that folks want to have? Questions? Yeah, go ahead, Mr. Voland.
Thank you. So I think in the responses that were sent to us, one of the navigation services that was identified that was being provided is healthcare. And is it Anchorage Neighborhood Health is maybe the provider doing that? So a couple questions. What type of healthcare are they providing? And then my second question would be, are they like subcontracted to do that, or they're just doing that of their own goodwill? Or because one of the things that we're looking at as we're entering budget season is implementing the recommendation of the Complex Behavioral Health Task Force to provide on-site case management and healthcare. And I think that's something I would be interested in putting out to bid and finding a great provider who could do that. So if you could just talk to me a little bit about what's going on currently, that'd be great.
So last week we had a meeting with Anchorage Neighborhood Health Clinic. His name is Kevin, I believe. And they came and looked at the facility and looked at some different spaces that they could utilize to see clients. So the actual services have not started. Just the conversation and just looking at the layout of the landscape inside. And we have a meeting this week. I'm not exactly sure on the time, but that's one aspect of the health services that we want to provide. The other thing is Gary Hudson, who is a part of the behavioral health committee as well. He has individuals that he's been walking alongside, kind of being like peer support as far as helping with med management. Those individuals are scattered throughout the shelter sites, so he kind of checks up on them. But I do believe that it calls for a little bit more robust conversation and implementation as far as what we can provide, what we should provide, and how we're going to do it.
Okay, and then are you aware of, as far as you're aware, is that just, again, something they're providing because they want to, or are they receiving funding for that? I guess I'm
That's
just unaware.
yeah, I know that Anchorage Neighborhood Health Clinic wants to provide that. They want to have a presence. I don't know what if there's a budget involved or what the costs are or anything. That's why I think it does call for a bigger conversation.
Okay, maybe I could ask Ms. Parks. They're not a subcontractor under the coalition, are they?
No.
Okay. Are you guys still working with Sala to do some of that work?
Through the chair, thank you. The SALA team works with the outreach teams that are contracted through different agencies, and they participate in the pop-up activities as well as some of the encampment work where the teams will go directly out into some of these more scattered encampments. And I do have some data on one of my slides that talks about what the last couple months have looked like and what types of services they've done.
Okay, thank you.
Great, thanks. Any other discussion on outcomes? All right. Yeah, well, I think for my part, I want to see those housing numbers keep going up month after month, and I appreciate everyone's efforts to make that happen. I guess just moving on to data and metrics, I think we got some good data and information on outcomes. Are there any other data points that the health department, administration, or the operator would like to share?
Nothing further at this point, Mr. Chair.
Yes, go ahead, Ms. Brunga.
So Ms. Johnson described that there was a bit of a challenge with the shower situation. I know that's not data metrics related, but I didn't want to let it go. So 1 shower for women and 2 for men. And with this increase in numbers, you still feel like you can manage getting people through showering, and how's that working?
Yeah, I think the concern was that if we were to raise above what we have right now, then there would be a problem. But as it stands, there is more men than female. So the 2 showers for the men are working, 1 shower for the female is working. But if we were to increase, that's one thing to consider being a problem.
Thanks. Yeah, and for my part, I think once the third-party operator, third-party oversight comes online, then I think we'll have a lot more data and metrics to chew on, so that we can continue to get a sense of how things are going. Okay, if there's nothing else, then I'm going to go ahead and move us on to our next agenda topic, which is using the transition out of emergency cold weather shelter to implement anchored home. So as I said last month, this committee is going to be digging into the transition out of emergency cold weather shelter early and often. Today, we're going to be hearing an idea from the Anchorage Coalition to End Homelessness, and I think it's important, as I said early in the committee, that anchored home and housing first really be the anchor policy for our work with both implementing emergency cold weather shelter and transitioning out of emergency cold weather shelter. So with that, let's go ahead, put up their presentation, and I'll turn it over to the coalition.
Thank you. So walking through this slideshow, I just want to highlight for people that what we are looking at is this plan to transition out of emergency cold weather shelter and how this approach this winter to having housing focused shelter along with those navigational supports is key to helping people navigate into housing, which is the solution to homelessness. So looking at this, the solution to homelessness is housing, operating under the principles that everyone is housing ready and that housing first is the key. Anchored Home sets that community goal, that is the solution, and that Anchorage is a housing first community. Next slide, please. So looking at communities who have succeeded in reducing homelessness, they take a coordinated approach, moving from a collection of programs to a community-wide response. It's strategic and it's data-driven. So Anchored Home gave us that guidance of how to build that coordinated approach so that we're not just providing services, but we're collectively reducing the rates of homelessness and increasing the rates of people staying stably housed. So those core principles include data-driven decisions, person-centered, housing-focused work, tracking our performance, and then the ability to course correct. So always coming back and looking at what we've been doing and where there are opportunities for improvement. Next slide, please. So housing is the solution and it's the next step. Homelessness is the result of not enough housing. And when we looked at the last gap analysis, which was early this year, it was identified that over 2,400 permanent housing units were needed to fill the housing gap in Anchorage. And as we know, it's only grown since then. Next slide, please. So looking at some data of where people are staying by project type. Looking throughout the past 6 months, where were unhoused people served at the end of the month? So recognizing that over the course of a month, highlighting in September, the Homeless Prevention and Response System provided services to over 3,000 people experiencing homelessness, and that they utilized those services 3,265 times. So you'll see people accessing multiple services. What this data is capturing is at the end of the month, where were those people staying? So movement through this system is fluid. Where people go can depend on the season. It can depend on the providers, the services that are available, what housing options exist, and other things. You can see it fairly well, but looking at September, for example, you'll notice that there are people engaging in street outreach services. That doesn't necessarily mean they are unsheltered, but that they've been accessing and engaging with the street outreach teams throughout the city. People who are in emergency shelters, transitional housing, and then permanent supportive housing and rapid rehousing queues. So these are people who are enrolled in programs that are providing permanent supportive housing or rapid rehousing services that are still looking for units. Recognizing that's a big challenge in the city, especially right now, to be able to find available units for people to move into. Next slide, please. So the work over the summer that the expanded street outreach teams did, just highlighting some key success metrics here. This would be over the course of the summer through the end of October. So 952 people were engaged, a total of 2,484 times. And 734 were new to a street outreach program. So that doesn't necessarily mean they are new to homelessness or even unsheltered homelessness, but having that expanded and larger presence in the community allowed them to be able to engage and access those resources. We had over 65 people move into permanent housing over the course of the last 6 months. Next slide, please. One of the core things that the outreach teams were doing were providing those basic needs items, food, hygiene, first aid items, clothing, most recently some winter gear. And then highlighting the work of the medical partner Sala, they averaged over 100 medical contacts every week. And over the course of this time frame, had 327 medical referrals to specialized services. So that might be someone who was identified as having an underlying chronic health condition who needed to access a specialist for that, or someone who was having a more emergent medical need and needed to be seen at an actual medical facility, a hospital, or an urgent care facility. This included holding events monthly from June through October, where we invited those service providers that are our partners throughout the community to attend and be able to have that one-stop shop, be able to engage with people experiencing homelessness who might need that help or that assistance. Next slide, please. So even in a tight market, there are units available and there's resources and strategies to unlock those units. The biggest barrier to housing in Anchorage is finding those units. So looking at what if the system bought its way into the market to ensure that those units were available as they were needed with the sufficient incentives and the supports to those landlords to ensure that people experiencing homelessness can be competitive even in this tight market. Next slide, please. The foundation for this work needs to follow these core principles of data, equity, funding, coordination, housing, supportive housing with those supportive services. So recognize that there are challenges in all of these areas, but this is the foundational work that builds on implementation of a housing project. Next slide, please. So using financial modeling, the all-in cost for housing 150 individuals, assuming there are no subsidies or outside contributions. Looking at the cost for housing, utilities, and those additional supports, whether that is case management supports or unit retention supports for 1 year, are just under $80 per day. If we were able to access units that had utilities inclusive in there, that reduces that cost even more. And looking at the current approximate per day expense for emergency cold weather shelter, again, these are all in numbers there, between $90 and $100. Next slide, please. So when we're able to access vouchers and rental assistance for individuals, those costs go down because you're not having to pay all of those expenses in an all-in model. So that cost goes down significantly when there is other resources available to that person. They just need that support or that leveraged asset to be able to support the whole expense of housing that person. Next slide, please. And then last, when we are able to access existing housing programs as well. In the data slide, I talked about how there are permanent supportive housing and rapid rehousing programs that have space and have people enrolled in them, but they're in a bit of a holding pattern because they're identifying units. They're looking to be able to bring all of those pieces of the puzzle together to get that person housed. And so again, when we're able to leverage some of those community assets and individual assets, that brings that cost down to house that person as well. Some of the other things that can come into play for those leveraged assets would be if someone has access to case management services, either through a medical provider or a relationship that already exists. If they're able to access a unit that is already furnished, that reduces the cost needed to get them into that housing. Next slide, please. So how do we pay for it? Looking at this model and looking at it as a public-private partnership model that uses those existing investments in a new way, and then capitalizing where individuals are able to access subsidies or other person-centered supports that can help support the costs of housing that person. So for 150 people, the all-in cost to house someone for 12 months is just over $4.6 million. Right now, there are already funding sources available, just over $1 million to help support some of those expenses. And then if we unlock individual funding sources, such as vouchers that we know are out there in the system, we talked about people in emergency cold weather shelter who have access to vouchers and are just having challenges utilizing those vouchers. As well as supports that people are able to access through mini grants or state funding, resulting in a funding gap to house 150 people of just over $2.4 million. Next slide, please. So measuring success. What metrics would help gauge the progress on this and measure whether this project is successful? So it starts with establishing a number of people establishing literal homelessness here in Anchorage, and then measuring the percentage of people who are exiting into permanent housing destinations. This is work that is done throughout the homeless prevention and response system as people are exiting to different destinations. So looking at increases in those percentages of people that are exiting shelter into permanent housing and reducing the returns to homelessness. So helping people to maintain that housing once they have it. And last, looking at the percentage of people experiencing homelessness that are moving into HUD or other subsidized housing programs. Next slide, please. So Anchorage is a housing first community, and we know that when people are housed, people have a platform to address their needs no matter how complex. So being able to provide those supports to someone once they are in housing will help ensure that they are able to remain stably housed and not return to homelessness. Next slide, please. So this pilot gives us a roadmap where we can quickly and sustainably move people into housing, which will then create flow in emergency shelter and other homelessness response services. This also helps reduce that ongoing need to provide those supports because someone is housed. And so their supports are built around their maintenance of their housing units and not an emergency response. Next slide, which is the end. We can leave it on the end one.
Great, thank you so much. So I'll go ahead and start, and then if other folks want to get in the queue. Thanks for that presentation. For me, I think what is particularly exciting about the approach is how it really puts Anchored Home to action, which is really great. And in particular, the ideas of braided funding and coordination among various funding sources and agencies. And it's something that we've talked about a lot of how we can get the biggest bang for our buck and coordinate all of our efforts in a more effective way. And we always talk about the Houston model as, they're really great at coordinating their efforts, at braiding their funding. And to me, I see this as a good first step for us to move in that kind of direction. So I really appreciate the efforts here. A few questions from me. When is this pilot going to begin? And the goal, I think, is 100 people housed. By when? And then is this pilot focusing on single adults, a specific kind of population, and a specific vulnerability level?
Yes, thank you. So I'm going to go a little bit backwards in the questions. The goal is to use this as a tool to help create flow and demobilize emergency cold weather shelters. So the goal would be to have those people housed by the end of April, which is the scheduled end to emergency cold weather shelter. In terms of the start, I would say that the resources that exist right now are already in play. So this work is work that was had the foundation laid throughout the summer as the street outreach teams engaged with people in a real person-centered, housing-focused way to help people access things like IDs. And if that person is experiencing a disability or that person has access to individual resources, helping to lay some of that foundational work to get access to that. In terms of like counting and starting to say these people are housed, I would say within the next week.
Great. And then I guess just one additional question for me. So I'm assuming that all of this is scalable work. And right now you're looking at a 150 pilot project, and you have, if I remember correctly, about half of it funded, and you're seeking additional funding for the other half. So basically, if you don't get that funding, then you'll only be able to provide this work for about 75 individuals. But you are looking for that additional funding to provide housing for 150 individuals. Did I interpret that correct?
Nope. And I think I would add that as we are able to identify resources that individuals have themselves, that does scale it as well. Because if that person has access to a voucher that can provide that rent assistance, that's fewer dollars that the pilot needs to pay into that person's housing stability. I would also say that it is scalable and also transferable in a way, because as we start to identify these units, as we start to build those relationships with landlords, I think that's going to unlock units larger scale as well.
Yeah, I'll leave my question on that for later. Does anyone else want to get in the queue? Yeah, Ms. Branca.
Where are you mining these residents for your pilot project? I'm just concerned that, we are going to have out there that this housing is coming online, and there's going to be a further push of people that are in living situations that they don't really like, but they're tolerating, and it's just going to keep getting huger. I don't know, that sounds cruel, but I know that there are people hunkered down in Rangeview Trailer Park with 15 in a mobile home that are making it work. And if this housing comes available, shouldn't they be, be able to scale down the number of people in their mobile home? I'm worried about this endless spiral this is going to create. And I also am a little concerned that I do feel that this anchored home is a great thought, but I also feel that homelessness is not going to be something that you're just going to plop someone into a piece of housing and they're fixed. There's a reason that they're experiencing homelessness, and if we are just plopping them into housing units without a lot of support, it's not going to work. And then I feel like there's certain people in our community that are always going to need the shelter. And if we put all our efforts into housing, then, and we have this shelter kind of as the bad place that we don't want, there are people who will always need that support. Even if we house them, they're going to fall off the rails occasionally. So those are things swirling around in my head. And I don't want to say that I don't appreciate what you guys are doing, but I fear that it'll be like the hotel shelter situation. When we hear there's some new housing available, then more and more will come.
Through the chair to Ms. Bronga, thank you. I'm going to hope I catch all of them. Let me know if I miss something. So looking at units, this doesn't envision creating additional units. This looks at taking existing rental units where there could be challenges with someone who is experiencing homelessness accessing them. Either that landlord has this is an example that landlord has an application fee and that person doesn't have the funding to be able to pay that application fee. Or that landlord is requiring 3 times the monthly rent in income and isn't recognizing that a voucher support maybe could substitute for that income because it is that source of funds that's going to pay the rent. It's just not necessarily income in that traditional manner. So it's not creating additional units. It's not a bear it in. It's taking the units that exist in the housing market right now and helping to figure out what the barriers are to accessing them and then come up with solutions for that. In terms of supports, this pilot is built to provide that case management and housing retention support, which is support for the tenant, but also support for that landlord so that landlord knows that there's a resource and those supports are in place for that tenant to help ensure that they are remaining stably housed and that they're able to troubleshoot when there are challenges in that person's rental. And then the last one in terms of talking about the need for shelter, I think that looking at this pilot and looking at what Housing First community really does is recognize that when housing is provided and it's provided with those appropriate supports, the chances of someone remaining housed and remaining successful go up substantially. And that emergency shelters can then become a little bit more like an emergency room of a hospital where someone is accessing that emergency shelter so that they can be triaged and they can have that assessment and then be connected with the right resources to help them get back into housing.
Thank you. That's very helpful.
Thank you. Mr. Voland?
Thank you. So yeah, I think it's really interesting. to hear from the unsheltered community that they prefer congregate, or rather non-congregate shelter and or housing. And I think we should be listening to that because, I truly believe that stable housing drives positive health outcomes, and we do need to sync up the supports and the case management. I think that's envisioned here, as Ms. Parks just explained. And I also think that housing is not always more expensive than congregate shelter. And I think you maybe had a little bit of a piece about that in one of your slides. But I was wondering if you could go back to the slide with the ask and like the amounts of funding that are there, and then the 2 million. Yeah, perfect. Okay, so the current funding sources, I'm curious about what those are, and the individual funding sources. And then as far as the funding gap, I mean, is the pitch today, is that would be locally funded, or will this presentation also be made to state legislators or in our federal delegation, or how do you envision accomplishing the funding gap?
Yep, I'm going to take those questions backwards also. I envision this being something that we are looking for people to want to invest in. So highlighting that it is intended to be a public-private partnership model. The current funding, so now I'll go backwards. The current funding sources do include philanthropy. There are allocations from private philanthropy, individual donations to support this, as well as ARPA funds that have been awarded that are able to help be some of those flexible funds to help people access housing. And then the funding that is available and some of the support that comes through the outreach services. So if it's someone who is unsheltered, having that flexible funding to be able to help them access document readiness, access some of those move-in support costs as well. Individual funding sources, a lot of those are voucher sources where someone might have access to vouchers or different types of rental assistance. A lot of those vouchers come with some of those supports as well. For example, an emergency housing voucher comes with funding to help support that ongoing case management, as well as move-in expenses and housing readiness. And then there are Mental Health Trust Authority mini grants that are available to people who are mental health trust beneficiaries that can be used to help support someone's housing stabilization or housing readiness as well.
Thanks.
Thanks. So I have myself in the queue next. Before I do that, though, can I get a show of hands of folks in the audience who would like to speak during final audience participation? You already spoke, Mr. Leva. I have one individual. Okay, got it. So we'll go ahead and save that time. Okay, so then, yeah, comment and then I guess question. So I think, largely speaking, can you go back to the slide where the gap analysis numbers were shown? I'll just tell you. There you go, that one. So we have a huge need for housing in our community, right? This figure, 2,500 units in our community for folks who are unhoused or extremely low income. So, I think for my part, I've always envisioned this as of when will this end? When will we have to stop focusing on housing and providing these additional supports? Is when we meet that goal, that is hopefully when a lot of this work ends and we have a fully housed population as much as possible. And then we focus on maintaining stable housing for folks. This is going to take years to get to 2,500 additional units. And the Assembly is focusing on the full pipeline of housing, which I appreciate. My focus tends to be on this number, the 2,500. And I know body-wide, the Assembly is focusing on everything on all price points, on all types of housing. By and large, this assembly strategy has been an and proposition, not an or proposition. So we must focus on shelter and housing, not shelter or housing. With the caveats that when we focus on shelter, we need to make sure that we are right sizing shelter, that we're not overbuilding shelter, because there needs to be a balance between investments we make in shelter and investments that we make in housing. And I think it's evident through the massive amount of funding that we put in emergency cold weather shelter that we do make investments in shelter. And I'm sure we're going to make more investments in permanent shelter that will hopefully reduce our need for more investments in emergency shelter in the future. But I think it's all a balance, and I think we'll continue getting this work done and meeting this need. And, for me, every year we need to be biting as a big chunk out of that 2,500 housing unit apple. That is for me the ultimate metric. Any other discussion for the coalition or questions? Okay, then I did have a review of the housing strategic plan on our agenda, but we're not going to have time for that. What I will encourage folks to do is just to take a look at the housing strategic plan. I believe there's going to be a one more time from the lens of this committee. I will invite folks to do that, which is really focusing on the affordability pieces, the controlling costs pieces, so that folks can maintain stable housing and not be priced out of their housing. I think that is the lens that I will ask folks on this committee to take a look again when you review the housing strategic plan. There is going to be a work session on the housing strategic plan in December. I think we're planning for December 8th, so you'll get an invite on that at some point. Okay, with that, then I'll go ahead and just do a quick update on our Assembly, legislative, and budget priorities. So, so a couple updates. We accomplished one of the priorities, which was to host a housing summit. So it went very well. Thanks to everyone who was able to attend that. Once the strategic plan is approved by the Assembly, we'll have accomplished the second half of that priority on our agenda, which is around developing a housing vision. There's also a variety of amendments the Assembly will be considering later this month with the budget that will meet another of our priorities around funding projects consistent with anchored homes. So I think we continue to make progress on our 2023 priorities and looking forward to that continued momentum. With that, let's go ahead and move to final audience participation. If we can get the timer up and if we can get a mic set up, please. Nope, just you. Can you turn the mic on, please? There you go.
Hi, my name is Allison Kerr, and I'm with Covenant House. And we're 1 month into it, and I thought I would call you guys and come here and give you guys an update. I would love to say that I could start with positive, and the positive is that last night all of our shelter spaces were all full, and so that means there were approximately 70 young people that were safe and warm and fed and staffed. But I want to talk a minute about some of the other challenges that we're seeing. We're averaging about 3 to 5 a week of overdoses on Narcan. And this, I've been in this work for 25 years, and we've never seen anything like this. It is not a matter of if it will happen, it's when, and it is absolutely petrifying to my staff. And that being said, I want us to think about the fact that while there is an issue of houselessness, there is also a fentanyl issue that is absolutely only being addressed, or it feels like it's only being addressed through providers that are delivering these services. And some of the ramifications of it are any consequence that we have for a young person and their use, then that young person, not in our space, is in our neighborhoods. It's in unsupervised settings, of which there has been some tremendous impact even within our own neighborhoods about what is happening. And, you know, everything from the ability for our neighbors to be empathetic. I know that we have many that care deeply about just all the positive things that every provider is doing, but I also know that that empathy is almost out. And I'm getting calls to say, you know, why don't you just let them die, right? As opposed to, as an organization, trying to do everything that we can. It is costing us, while we have 400,000 over the 6-month period of time, it is costing us, we're losing about $100,000 a month to deliver the emergency cold weather because of the intensity and the acuity. There is a de facto warming tent that's going on downtown. It's our lobby. And every morning I walk in, there's about 50 young people, you know, 50 between coming out from the 25 to the 25 that didn't get a bed. And so I really just want us to continue to realize, while we have some solutions in place, I don't believe any of them are offering us the pandemic perfect answer for what's happening.
Thank you. Did anyone else want to speak? Provide that opportunity one more time. All right, then not hearing anyone else, I will go ahead and adjourn the meeting. Thanks, everyone.